We're going to be going through some different questions now.
Thank you, Kathy. The responses to the Hi, Kathy. The responses to questions will be provided by Kathy and Joan Proctor. Joan is the National Coordinator for the Home Health Quality Reporting Program. Joan has worked in CMS for 20-plus years in various areas of topics, including home health and hospice policy issues, demonstrations, and physician practitioner claims processing issues. Joan also has a Master's of Science in Healthcare Administration from the University of Maryland University College. So now that so many questions have come in, Kathy and Joan will be responding to the questions. The first question I see that has come in is, how do I access and use the review and correct report? Kathy, can you provide a response to that?
I certainly can. The review and correct reports are available to the providers on a quarterly basis. To identify whether you have quarterly data available and how to actually access it, you're going to follow these steps. First, log in to the Centers for Medicare and Medicaid Services network using your Net User ID and password. Access the Welcome to the CMS Quality Improvement and Evaluation System for Providers webpage. Select the CASPER link. We showed that to you on an earlier slide. Enter your KEYS user ID and password on the login page. On the CASPER homepage, select the Reports button from the menu bar across the top. A list of report categories will display in the left-hand frame of the page. Select the Home Health Agency link, and a list of quality measure reports will display in the right frame of the page. Select the Home Health Review and Correct Report link, and the CASPER Report Submit page will display. Verify the quarter and the year option that displays in the End Date field. The quarter and year-end date option will automatically be updated on the first day following the end of the previous calendar quarter. The most current quarter and year option will display by default. Older quarter and year options are also available for selection. Review and correct reports remain in the CASPER folders for 60 days. It is important that providers use the review and correct reports while the data correction period is still open so that you can correct the information if needed. Obtaining and using the reports shortly after they become available is advised so that, again, your correction period is still open and you can correct information as needed.
Thank you, Kathy. Joan, I see another question that has come in. The person is asking, I cannot access our agency's review and correct report. Where do I go for help?
Sure.
Joan?
If you have any technical issues requesting or accessing the reports, please contact the KEYS Technical Support Office Help Desk by email at help@qtso.com or by phone at 800-339-9313.
The next question. If there is a dash listed in the report, is there an issue? Kathy, please respond.
When you see a dash in the report, please review the table legend on the report. The dash indicates that the data either are not available or not applicable. Providers should confirm that all required data has been submitted if applicable.
Thank you. I see that we have a question that's asking, are these reports available in CASPER already? I haven't been able to find them.
Sure,
Kathy?
the review and
Sorry, Joan. That's fine.
Sure. The Review and Correct report is currently available in CASPER for all agencies that have submitted a minimum of 100 complete quality episodes. A complete quality episode requires both a start of care, initial assessment, or a resumption of care, OASIS assessment, and a transfer or discharge, OASIS assessment.
Thank you, Joan. I'm looking at the next question. I think, Kathy, you've already talked about this, but I will read it anyway. When selecting a time frame for the Review and Correct report, can I review data for only one particular quarter? Kathy?
The initial Review and Correct report contains data for only one quarter, quarter 1, 2017. With each subsequent calendar quarter, the report includes another quarter of quality measured data. For 2017, the report will give you data based upon the following end dates. Q1 2017 includes data for Q1 2017 only. Q2 17 includes data for quarters 1 and 2 of 17. Q3 has data for quarters 1, 2, and 3 of 17, and so on. When you get to quarter 1 of 2018, you're going to have data for quarters 2, 3, and 4 of 2017 and quarter 1 of 2018. As we said earlier, you are allowed to request the report for much older quarters, but requesting the report with the end date for quarter 1, 17 is the only time that data will display for only one quarter. New or corrected records are accepted by the Assessment Submission and Processing, ASAP, for open quarters and is included in the next weekly quality measure calculations. Note, new or corrected records with target dates during the quarterly period that were submitted after the data correction deadline will not be included in the weekly quality measure calculations for the Review and Correct report. That's the reason why you have to watch that data correction deadline carefully.
Thank you, Kathy. Joan, here's a question for you. How often are Review and Correct reports refreshed? How soon are corrections and edits reflected on the report?
Thank you, Sharon. Data for the Review and Correct reports are updated or refreshed as follows. Weekly measure calculations are performed in the early morning hours every Monday. Quarterly measure calculations, to allow a quarter to be displayed on the CASPER Review and Correct report as soon as that quarter is completed. The Review and Correct quality measures are calculated and updated in the early morning hours of the first day of the following quarter. This is essentially an extra weekly run that occurs on the first day of a new quarter. End of quarter calculations, to close a quarter, the Review and Correct quality measures are calculated and updated 4.5 months after that quarter is completed. On the 16th day of February, May, August, and October, the quarter will be processed and marked as closed. Note, new or corrected records with target dates during the quarterly period that were submitted after the data correction deadline will not be included in the weekly quality measure calculations for the Review and Correct report. Sharon?
I'm sorry, yes. Kathy, the question is that I have next, is there a recurring day of the week that reports are refreshed? Again, I think this is one that was covered, but I'll let you respond.
We did go through this in one of the early slides. Weekly quality measure data calculations for the Review and Correct report are done in the early morning hours every week on Monday.
Thank you, Kathy. How will I know that my Review and Correct report is available for download? This is a two-part question. I will receive a notification when reports are added to my CASPER folder. Joan, can you provide a response to this question?
Providers do not receive notification when the reports are available in their CASPER folder. There is no function within our system to provide you notification that the report is complete. As with user-requested CASPER reports, the completed reports will be automatically saved into the requester's inbox folder in the CASPER reporting application. Here are the steps to locate the completed report. Following a report submission request, users receive verification that the report request was placed into the queue for processing. If desired, users can select the queue button from the CASPER toolbar to view the status of a requested report. Select the refresh button to refresh the CASPER report queue page so that you can monitor the progress of your report. When your report is no longer listed on the CASPER report queue page, it is done processing. Select the Folders button, and a list of folders associated to the user will be displayed in the left frame of the web page. Select the My Inbox link, and a list of the completed reports will display in the right frame of the web page, with the newest report at the top. The report link names identify the type of report in the folder. For example, the link for the Home Health Review and Correct report is titled HHA Review and Correct Report. Thanks, Sharon.
Thank you, Joan. Kathy, this submitter is asking, she says, he or she says, you said that review and correct reports would be available on a quarterly basis, but that they would be updated weekly. Can you please clarify if the reports are updated weekly? How are they only available quarterly? Kathy, please.
Thank you, Sharon. The review and correct reports are available on a quarterly basis for up to the past 4 full quarters as the data is available. The reports include information on whether the data correction period is open or closed, which means whether assessments can be corrected. The reports are refreshed or updated weekly to reflect any changes made to the OASIS assessment data.
Thank you. Our agency noticed an operational issue with our electronic medical record, but corrected the assessment data and updated inaccuracies in the ASAP system prior to the 4.5-month period, 4 to 5 month data correction deadline. We would like to confirm that the corrected data will be included in the data for public reporting. Joan, please.
If you corrected the assessment data via the CMS Keys ASAP system prior to the submission deadline or freeze date, then the updates will be reflected for public reporting. If a provider corrects assessment data after the quarterly reporting deadline, the corrected data will only be reflected in the facility and patient-level tally reports. Corrections will not be reflected in the review and correct provider preview reports or compare website. It is important for providers to verify their assessment data via CASPER prior to the correction submission deadline. Using the CASPER system, you can monitor the assessment data entered to correct any errors. Please refer to the Home Health QRP webpage for details related to QRP reporting data submission deadlines. Thank you, Sharon.
Please clarify the need to submit data. Aren't the data being submitted automatically when the outcome assessment information set OASIS is closed and submitted? What needs to be submitted? Kathy, can you provide a response, please?
Yes, Sharon. The data required for the Home Health QRP are being submitted when you enter your OASIS assessments.
Thank you. I see that there's another question about the quality measures. It's asking, when calculating the number of eligible patients discharged from an agency during the reporting time frame used for the quality measure, do you only include Medicare patients? Joan, please.
Sure. HHAs do not need to submit OASIS data for those patients who are excluded from the OASIS submission requirements. As described in the December 23, 2005 Medicare and Medicaid programs reporting outcome and assessment information set data as part of the conditions of participation for home health agencies final rule. We define the exclusion as those patients who are receiving only non-skilled services for whom neither Medicare nor Medicaid is paying for home health care, and the plan are not excluded from the patients receiving care under Medicare or Medicaid managed care plan are not excluded from the OASIS reporting requirement. Receiving pre- or postpartum services are under the age of 18 years. Thank you.
Thank you, Joan. Kathy, if I want to find out how to calculate a measure, where can I find this information?
Thank you, Sharon. You can review the quality measure specifications listed in the download section on the Home Health Quality Measures page. The actual live link is on one of the earlier slides in the presentation. If you go back, you'll find it. I'm not going to try and remember how to give it to you, but you can find it on the slide, and you should definitely go there to download that information.
Thank you, Kathy. Joan, I think I'm going to give this one to you as well. When the report says adjusted for risk, how are the adjustments done? How do we verify whether the data are correct? Joan, please.
Sure. Please refer to the Home Health Quality Measures specifications listed in the download section of the CMS Home Health Quality Measures page. And similar to the response that Kathy gave, I'm going to suggest that you look at the actual training slides for the link, the live link. Please note that the review and correct reports contain observed results only, not risk-adjusted results. The quality measure reports and provider preview reports provide risk-adjusted results. Thank you.
Thank you, Joan. Is there a way to measure the agency's progress in quality measures on a more frequent basis than quarterly? Kathy, please.
A provider can run the review and correct reports and quality measure patient level and facility or agency level data reports on a weekly basis to help with their internal quality improvement activities.
Thank you, Kathy. There's a couple more. Let's see. How about are the quality measures for the home health agency taken from the submitted OASIS assessments? How do we verify whether our data are correct? Joan, can you provide a response?
Yes. The data for calculating the home health quality reporting quality measures are obtained from the submission of OASIS C2 data through CMS KEYS ASAP system. No additional reporting is required. HHAs have opportunities to review their information and validate their data for measure calculation using other reports available through CASPER, such as data submission reports, which give providers information on fatal errors and warning messages related to data submission. Thank you.
Thank you, Joan. We are just about out of time. I am going to do this one last question. And Joan, can you respond? Is it true that only a number of staff have access to CASPER?
This is correct. Please contact the KEYS Technical Support Office Help Desk by email at help@keetso.com or by phone at 800-339-9313 for any issues related to your access to CASPER. Thank you.
Thank you, Joan, and thank you, Kathy. There was one other question. There were several questions coming in asking about being able to get access to materials. For all participants, please note that all of the materials is currently posted on the Home Health website. The pre-training materials are posted without the answers, but later the materials with the answers will be posted. So I apologize. We're sorry, but we've run out of time for today's webinar. We have responded to Several of the questions that were submitted today, we apologize if you submitted a question and it was not answered during the webinar. Please check the CMS Home Health Quality Reporting Training site, where all responses to submitted questions will be posted later. Okay, that's great. So we're going to wrap up today's event, and I just want to say thank you, Kathy, for sharing your valuable knowledge during today's webinar. This concludes our webinar for today's Home Health Quality Reporting Program and Review Correct Reports webinar. We also would like you to know that the full version of the slides, including the answers to the polling questions as well as the recorded version of this webinar, will be posted, and we will send an email notifying you when and where those items have been posted. Thank you all so much for attending, and enjoy your day. I hope you found this webinar helpful and meaningful. Thanks again.
This concludes today's webinar. Thank you all for attending.